I can't hear the loud ones. You can come louder. Thank you. Please be seated. In Nigeria, the COVID-19 pandemic has spread as rapidly throughout the country as it spread around the world, leaving footprints of an illness affecting the economy and the whole of society, with debilitating effect on some countries and systems. There is no doubt that these have been trying times for humanity, for all countries, and also for every Nigerian. Despite the challenges, there is now hope of relief with the introduction of the much-awaited COVID-19 vaccine. Vaccination with safe and effective vaccines against COVID-19 is a critical part of Nigeria's strategy to counter the pandemic and stop transmission of the virus. To this end, several research bodies and pharmaceutical industries have responded to the call to develop a safe and efficacious vaccine against COVID-19, and it has yielded results in record time in various areas of the world. We in Nigeria finally have the privilege of being able to join other countries in kickstarting the immunization program, which will prioritize, first, those people most at risk of infection due to their exposure in the line of duty, those are the frontline health workers, and also those who, if they get infected, are at highest risk of severe disease. All these have been as determined by available epidemiological data. Our goal is to introduce the COVID-19 vaccine in a phased and equitable manner based on advice of the World Health Organization and the experience we have observed other countries to make, and ultimately vaccinating all eligible Nigerians within the next 2 years in order to ensure herd immunity. TEACH, which is TEACH, is an acronym for a 5-point strategy developed by the Vaccination Implementation Arm of the Federal Ministry of Health, which is the National Primary Healthcare Development Agency, out of its many, many years of vaccination implementation experience in Nigeria, and most recently, as has already been said, with the Polio Eradication Initiative. And that acronym translates as follows: T for Traditional Vaccination Campaign Approach, E for Electronic Self-Registration by Eligible Nigerians, A for Assisted Electronic Registration for Eligible Nigerians, C for Concomitant Vaccination alongside electronic registration, and H for House-to-House Electronic Registration. This is very well put together. And it is the launching of the TEACH strategy for COVID-19 vaccination and electronic management of immunization data that we are here gathered to perform today as a very important activity to assure Nigerians of our readiness to roll out the COVID-19 vaccination campaign smoothly. I am delighted and privileged to be leading this event as Minister of Health at this time. I assure you that the world is inching closer to gaining control of this pandemic, and with all the emphasis Nigeria, the Ministry of Health, and NPHCDA have placed on the various pillars of our overall response strategy, from community engagement and risk communication, to improving COVID-19 case management, to maintaining routine and essential medical services, to providing more timely physical and eventually financial access to healthcare service during times of personal health emergency, so that we do not leave any Nigerian behind and we do not suffer decline in other areas of healthcare. And now to the access of all eligible Nigerians to COVID-19 vaccine administration. I again commend the National Primary Healthcare Development Agency under the leadership of Dr. Faisal Shuaib and his very hard-working team, who have developed a homegrown strategy to deliver this novel vaccine. The introduction of electronic management and immunization data is critical to addressing challenges we have with integrity and quality data, and ultimately primary healthcare data. Dr. Faisal has very elaborately described this to you and all the benefits that Nigeria will have from the past, and also the benefits that will help us in the future. I therefore urge all stakeholders, partners, subnational governments, corporate organizations, to have faith for once in the plan that the government is developing and to align with the initiatives born of years of experience in the immunization space. No private hospital or organization has the experience with handling this type of novel vaccine, and certainly not the experience in vaccine application that NPHCDA has. All questions about the vaccine can be directed to the Ministry of Health and to NPHCDA. But this is not a time to work at cross purposes. It is not a time to be making private or parallel arrangements for vaccine procurement and or vaccine administration. This will only disorganize what has been so carefully planned out and create chaos. Vaccines that are not approved by NAFDAC will be determined as dangerous, and they will be seized by customs and NAFDAC, who are on high alert for illegal vaccine importation. Fake and falsified substandard vaccines are already around in the global illegal market. The federal government is in a position to take care of all the interests of various segments of society and to handle all, I emphasize all, requests and wishes from all areas. We have received requests from foreign embassies and international organizations to be included in the vaccination program, which will be professionally handled. We have also worked very closely with the private sector, and I here want to again join in appreciating the CACOVID, who have offered to support us, not only financially, but also with making the necessary contacts and access to all our desires in the health sector with regard to COVID-19 vaccine acquisition. Nigeria has opened an account with the Afrexim Bank, through which all procurement we make will be paid for. Any corporate organization that wants to support the government effort is invited to consider making that contribution to that account. Government does not need to receive your donation. The Ministry of Health does not need to receive it. MPACA does not need to receive it. The account is there for all those who want to support us. And as I have said, the interests of all organizations can be safely, easily, competently, and professionally accommodated by NPACDA strategy. In less than 24 hours from now, the first batch of AstraZeneca vaccines will arrive in Nigeria from the COVAX facility and will be deployed to vaccinate first, as I said earlier, the critical frontline health workers who are providing essential care, especially for the severe COVID-19 patients. Next are those who are at high risk of severe disease. Every health worker who gets infected, we have to go into isolation, and that means one more less staff. That is the reason why they are prioritized, because they are exposed. We want to be able to have covered 70% in order to achieve our desired herd immunity. The World Health Organization has advised all countries to limit vaccination for now to persons above 18 years of age until research and studies are completed on any possible effect on growing children of 18 years and below, except such children have severe underlying illnesses where the benefits of vaccination justify the risk. All countries are following this guideline and other global guidelines issued by global authorities, as Nigeria will also do. This is made all the more important by the fact that the target population for our vaccination exercise, we must remember, is not the usual cohort of children that we are used to, but this time adults. As a novel vaccine, NPACDA has trained vaccinators to be ready for the known and unknown side effects, which will be handled professionally and recorded for knowledge. And let me add here that the government has had to issue what you call an indemnification for these vaccines because they are new. And they should not be handled as if they are regular routine vaccines like tetanus vaccines or other vaccines. They need to be handled centrally, properly governed. As we have been told, TEACH is a hybrid of our traditional vaccination campaign using the microplan and the electronic registration systems seen in advanced countries. The development of this hybrid is commendable, and I'm sure our immunization landscape will be much enhanced by the experience from this exercise. NPACDA will take advantage of the best available knowledge and skills in the world with regard to the unfolding COVID-19 vaccine space. I urge all eligible Nigerians to take advantage of the COVID-19 vaccination exercises when it is their turn. This is the only way we can achieve our target of herd immunity to stop community transmission of the virus. Well before the 4 million doses we are going to receive, the 4 million doses of AstraZeneca, well before it is expended, we shall be receiving more vaccines. So there should be no need for anxiety. We shall also be receiving other types of vaccines, and all this will ensure that the entire vaccination administration will be sustained in a smooth way, and also will be applied nationwide. No one will be left out, no one will be left behind. I want to thank all our partners who have been working very hard with NPACDA under the auspices of the COVID-19 Technical Working Group and also the COVID-19 Vaccine Coordination Committee. I urge you all not to rest on your oars until we complete this exercise, which should last 2 years, but which within the next month or two, we go through the initial phase of learning and adaptation of the plans to reality. I am not ruling out the fact that there may be a hitch here and there, but this hitch will not arise as a result of not having tried. There will probably be hitches due to the unknown and unforeseen. But sooner or later, we have a routine, smooth, operational system for the vaccine administration. So we'd like to also here ask that you show understanding if there are any initial unavoidable hitches, as we have seen in every other country in the world, and I have constantly drawn the attention of MPACDA for us to sit down and look at any imaginable gap in our system. And I can say quite clearly that they have responded very well and tried to cover all the gaps that we can see. But since man is not perfect, it's possible that there are still one or two little gaps which will be addressed immediately as they appear. Here, I want to acknowledge and appreciate the critical role the media has played in supporting government in this exercise. Your role is extremely important in passing on accurate information and supportive information, and also in not participating or propagating fake news, false rumors, disinformation, and misinformation that can crop up anywhere. Distinguished ladies and gentlemen, it is my honor and privilege now to hereby officially launch the Teach strategy for COVID-19 vaccination and the electronic management of immunization data system in Nigeria for the health of our people and to the glory of God. Thank you for your attention.
We approved these vaccines on the 18th of February after a very arduous task, but our work started around that time too, because MPHCDA and NAFDAC have been working round the clock to ensure that the vaccines arrive safely. We have to give an exemption to the arrival of the vaccines because we put a gateway to drugs coming from Southeast Asia to avoid substandard falsified medicines. So we have to give a special exemption for these vaccines because we want to be sure that the vaccines or drugs that are coming to our country have quality. I want to congratulate Dr. Faisal Shoaib for the hard work, but more importantly for our Minister of Health, our Honorable Minister of Health, for the guidance. It has been a rough ride, but we are here today, and our work just started. Our work just started because we're going to do track and trace of all these vaccines that are coming in to ensure there is no falsification during the supply chain. We're going to do pharmacovigilance to make sure that we monitor any side effect that could happen to the individualized patient. So we want to say thank you again for coming, and I want to congratulate Dr. Faisal and WHO. WHO is the one that is actually giving us the green light. So everybody on the high table are commended. Thank you so much, and God bless.
A round of applause for him.
On behalf of the UN Resident Coordinator, Mr. Edward Callum, and on behalf of other development partners, I wish to congratulate the Honorable Minister of Health, the MPACDA, and the government of Nigeria for this important milestone. It's just 1 year since we commemorated, not celebrated, we commemorated 1 year since the first case of COVID-19 was detected in Nigeria. Ever since, we had more than 150,000 cases, but sadly, we lost close to 2,000 of our community to this deadly pandemic. But beyond that, and it has now been recognized Nigeria has led an exemplary response to COVID-19. Nigeria has averted the catastrophe that was predicted by several models. And this is because Nigeria was among the first one to show how political leadership can translate into result. The first COVID-19 case hit Nigeria, found Nigeria with a strong background of preparedness. Ever since, Nigeria has refined its intervention strategies, adapting to WHO guidance. And one of those is the vaccination, now that new vaccines have been endorsed by WHO for emergency use list. It's really pleasant to witness the launch of the TEACH strategy just ahead of Nigeria receiving its first batch of AstraZeneca vaccine. This new strategy, the TEACH strategy, will really help to ensure the governance mechanism, the accountability, the coordination, security, and ethics around the vaccine are followed through. The tool will ensure that Nigeria uses the best innovative strategies to track the introduction, the vaccination of the community wherever they are. It's really commendable, and I would like to assure the Honorable Minister of Health, the NPSCDA, ED, the entire government of our availability to continue to support the government, the community, the stakeholders, and all those who will be engaged in this exercise. It was rightly said, this year is about COVID-19 vaccine. But I would like to emphasize that vaccine alone will not do it. We will need to continue to adhere to public health and social measures until such time that we reach enough coverage to generate herd immunity. Congratulations again, Honorable Minister. Congratulations, ED, NPSCDA, the UN system as a whole, but also the other development partners will stand by and support and provide any additional support that may be required by the government of Nigeria to ensure that everyone that needs the vaccine receive it. I thank you.
The National Primary Healthcare Development Agency is a government-recognized agency for administering vaccines. In this case, we are dealing with a new vaccine. Its properties are not fully known. They are unfolding globally wherever they are being used. And we are also going to be observing very closely what the effects are. Now, governments have had to sign what you call an indemnification, which means that the producer will not be necessarily held responsible for whatever the effects are. Whether you get immunized or you do not have the immunogenicity, or if there are adverse effects. So therefore, these adverse effects can come up. And if there are vaccines, thank you. If there are vaccines administered through correct government portals, vaccines with a recognized batch number, government will stand up for every treatment that follows it. You will not be charged for it. Government will make sure that you are lost to good health, because you gave that indemnification. Secondly, is that the vaccine is free. Nobody is going to be asked to pay for it. But as I said during my speech, there are organizations that have asked to support government with donations. I can say clearly here that the central bank, and we thank them for that, the Govt Foundation, we have spoken with, and the This Day organization, and even the BUA organization have offered to support government, but that support, if it has to be in a financial form, and go straight to an account that government has in Cairo with Afrexim Bank, that's the procurement organization. And whatever vaccine comes in is known, its batch number is known, it's coming directly from a factory. So government will be able to stand for those and for their effects. But anything else coming otherwise will be impounded by NAFDAC and will not, because we regard it as dangerous. We do not know the source. We know that there are many fake vaccines, substandard vaccines, and falsified vaccines already in circulation. We have been warned. So compensation means that government will be ready to cover the cost of handling any adverse effects. I believe that covers the third question that came in here. And you can imagine that if private people start administering these vaccines privately and effects happen, they're out of control. And therefore, you are at risk of being on your own if anything happens. And the government also will not have data of what you were given, who gave it, when, and what the reactions were. So we are going to here advise the public to stick directly with the advisory that NAFDAC has, that NPACDA has given, and not to indulge in vaccines given around the corner or by the roadside. As for vaccines administered in rural areas, no charge is to be made. These are supposed to be free. If anybody is asking for money, make a report immediately, and those reports will be followed up very stringently, because the idea of government is to provide access to everybody at no cost to them. And if we are going to start charging money, it means that those who do not have the money will be left out, and we shall not achieve the herd immunity we are looking for to keep all of us safe from the vaccine. I hope these answer the questions that we are talking about.
How we are addressing the concern around the ability of the Federal Ministry of Health, NPACDA, and the partnership to keep the vaccines at the right temperature. Well, first and foremost, what we have done is to prioritize a vaccine such as AstraZeneca that is stored at a temperature of +2 to +8 degrees Celsius. This is a temperature environment that we're very familiar with in our country. Most of the cold chain equipment that we have actually are compatible with that temperature range. Other vaccines that we're likely to get will also prioritize vaccines that we're able to store within +2 to +8 degrees Celsius. In transporting these vaccines from the national to the subnational level, we have reached an arrangement with Govt where they will use their cargo planes to transport the vaccines to all states that have functional airports. Those states that do not have functional airports will have their vaccines delivered to the nearest functional airport, and we will use our cold vans that have the capacity to maintain the relevant temperatures to move the vaccines from those nearby states to the designated states. So as of this point, we're not concerned about the potency of the vaccine as a result of the temperatures. The temperatures of our cold chain equipment are exactly what we needed them to be. I have mentioned in different fora that beyond the national level, the state level, the local government level, even in our political wards, We have been working with our donors, particularly Gavi, the Alliance for Vaccines and Immunizations, to deploy solar direct drives to all political wards in a way that will ensure that in every political ward we have at least one solar direct drive which uses solar energy. So even if there's no electricity, because they use solar energy, they're able to maintain the vaccines in the right temperature. These are cold chain equipment that we're already using for our routine immunization program. So it's not as if we're procuring just for COVID-19. Approximately 7,000 of about 9,000 political wards that we have already have these solar direct drives installed. Even as I speak, we're in the process of installing solar direct drives in the remaining 2,000 or so political wards. Our estimate is that we will complete this process by the end of 2021. In the meantime, any political ward that doesn't have a solar direct drive will liaise with neighboring wards and the local government areas. And we're working with the states and the local government areas. We have identified those health facilities, those wards without the solar direct drives, and we'll be able to get the vaccines to them. Some of the primary health care centers, some of the political wards without the solar direct drive actually have general hospitals or teaching hospitals that have this equipment. So we're going to be working with the states, very closely with the states, to make sure that the cold chain equipment is maintained. One of the conditions for delivering vaccines to any state or local government is fulfilling some stringent criteria. If we're not satisfied with the storage capacity of any local government area, then we will not be sending any vaccines there. This is why we're doing another round of validating the capability of local government areas and states to store the vaccines. We don't want to deliver vaccines to the states, and because there's no electricity in the cold store, the vaccines are wasted. These are very expensive vaccines that come in high demand. So I want to assure you Friday that we're very cognizant of the fact that some of these vaccines in the portfolio require special conditions. This is why we're prioritizing the AstraZeneca and the Johnson & Johnson, which are kept between +2 to +8. We're also looking, the Honorable Minister is providing leadership in the conversations with the Russians. The DG of NAFDAC is also engaging with the Russians, including other vaccines. The Sputnik V vaccine is also another vaccine that we're looking at, and that requires +2 to +8. So those are the vaccines we're going to be prioritizing. You may be aware that even the Pfizer vaccine is now being adapted in a way that makes it possible to not be absolutely required that it is kept at -80 degrees Celsius. They've now applied to the United States Food and Drug Administration, providing evidence that it is possible to store this vaccine between -25 to -15 degrees Celsius. These are temperatures that we've kept our oral polio vaccines. So we also have capability of storing those vaccines. But we'll wait until we have full information that those temperatures are compatible with the Pfizer vaccine. Again, we're working with NAFDAC to make sure that any vaccine that is approved to be used in Nigeria must be safe and effective.